Hello, my name is Wajaha, and today I'm going to cover Wilms tumour. So this is just a continuation from some of the previous pediatric videos I've made. So let's get started. Wilms tumour, also known as nephroblastoma, is a type of kidney cancer and it affects children. It's the fifth most common type of pediatric cancer, and these patients are often quite young, with a median age of 3, so these are less than 5 years old. But despite that, it's got quite a good prognosis, and 80 to 90% of patients survive after 5 years. Why do people get this? Well, it's genetic, and it's a mutation on one of the genes called WT1 that causes it. And this is a deletion mutation. You can see from my amazing diagram how I've demonstrated this. WT1 is actually a tumour suppressor gene, but these genes are involved in genitourinary development. Now, Wilms tumour is associated with other developmental syndromes, and one of them is called Weger syndrome, and 10% of patients with Wilms have this. Now, usually I create a mnemonic for you guys, but today I don't have to. Every letter in Weger stands for something. So W for Wilms tumour, A for aniridia, which is the absence of an iris in the eye, G for genitourinary abnormalities, and R for mental retardation. Now, it's associated with other conditions as well, and these have different types of mutations, deletion mutations in other genes. Now, moving on to the signs and symptoms. Initially, we don't often see any symptoms, and this is because the tumour is often quite small. Once it starts to grow, then we can see symptoms, and exams often have this triad of symptoms that I think is really important for you guys to remember. So, first one, painless palpable abdominal mass. Now, in 95% of cases, this mass is going to be unilateral, as in only affecting one kidney. I'll go on to why that's important later. Secondly, painless hematuria. And thirdly, hypertension. And that hypertension is caused by renin secretion. Interestingly, constitutional symptoms are not that common, so things like weight loss, night sweats and tiredness, but you still can get them. Now, investigation-wise, we start off usually with some imaging, ultrasound, abdominal ultrasound, or a CT, and that can also help with looking for metastasis, as 20% of cases do have some element of metastasis, but eventually we do need to do a biopsy. Now, this condition can be staged, and it's split in between stage 1 and 5. Stage 1 affecting the one kidney only, 2 spreading to nearby structures, 3 to lymph nodes, 4 distant metastases such as the lung, and 5 affecting both kidneys. And each stage has a different management plan. But essentially, the management involves these 3 things: surgery in the form of nephrectomy, which is the removal of the kidney. And as I mentioned earlier, because it's unilateral in 95% of cases, this is something that we can do, and why kids have such a good chance of survival. Chemotherapy is usually done first to try and shrink these tumours, and we can add radiation therapy if need be. So lastly, just moving on to a couple of questions. Here's the first one: what is the most common presenting feature of Wilms tumour? So if you look at the options, there's 2 that I mentioned earlier on. We've got the abdominal mass and we've got hematuria. Now, the most common one is the abdominal mass, so that's the answer to this. And the last question: a 4-year-old boy presents with his mother, who's worried as she notices that his urine is often a dark reddish colour. She's also concerned that he is beginning to eat less and less over the past couple of weeks. On examination, he is afebrile and there is no history of any recent illness. The mother mentions that his father and grandfather both had kidney trouble, but is unsure of what their diagnosis was. Examination reveals a distended abdomen, which is soft and non-tender. A palpable mass is felt in the right flank. What is the most likely diagnosis? So let's break this question down. So we've got a 4-year-old boy. As I mentioned, these patients are younger than 5 usually. The urine is a dark reddish colour, and we know what that is, hematuria. He's also begun to eat less. Now this is really important. The father and grandfather had some sort of kidney trouble, and we know that this is a genetic condition. And lastly, there was a non-tender palpable mass felt in the abdomen. So based on these 5 options, we know that it's just going to be one thing, and that's Wilms tumour. So that's all I wanted to go over today. Thank you very much for listening. Please like, comment and subscribe, and I'll be back with another video soon. Bye.